The listening part of Occupational English Test has 3 parts, and in each part you will hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract only once. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check answers. Part A. In this part of the test, you hear 2 different extracts. In each extract, a health professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a doctor talking to a patient called Mr. Chong Walton. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Hello, Doctor. Good morning.
Good morning. Please be seated. May I know what's your problem?
Well, Doctor, I'm getting severe pain on my left knee and stiffness. I'm having severe bilateral knee degenerative joint disease, left greater than right, with significant pain and limitations because of both. Usually, I'm able to walk approximately just half a kilometre a day, but that is limited due to this condition. I had arthroscopy 2 times within the duration of past 18 months. I have been on a long-standing conservative course for these, including non-steroidals, narcotics and injections. Now, due to the progressive and persistent conditions, I have opted for a total joint surgery on the left side.
Okay, what's your age?
48, Doctor.
Do you have arthritic complaints as well?
Yes, Doctor. I have arthritic complications, including multiple back surgeries for spinal stenosis, including decompression and epidural steroids. I was working as a driver with a beverage company, but now I have retired from my job due to this condition.
Okay, what are the surgeries you have undergone so far?
Inguinal hernia on the left, Baker's cyst, colon cancer removal, bilateral knee scopes, right groin hernia, lower back surgery for spinal stenosis, status post-colon cancer second surgery.
What medications are you taking?
Ambien, 12.5 milligrams bedtime. Methadone, 10 milligrams twice a day. Lisinopril, 10 milligrams daily. Demerol appears to work the best in handling my pain.
Are you allergic to any medicine?
Levaquin and Cipro cause rashes. Ibuprofen causes my throat to swell. Fortas causes an unknown reaction.
Do you have any family history of disease?
Yeah. Cancer and coronary artery disease.
Well, your physical examination results show weight 167, blood pressure 148/86, pulse 78 per minute and regular. Musculoskeletal examination of your left knee reveals a range of -10 degrees extension, 126 flexion. Your extensor mechanism is intact. There is mild varus. You have good stability at 30 degrees of flexion. Lachman's and posterior draw are negative. You have good muscle turgor. Dorsalis pedis pulse 2+. X-rays reveal severe bilateral knee degenerated joint disease, with joint space narrowing medially, as well as the patellofemoral joint with large osteophytes, left greater than right. You have paresthesias down into your thighs secondary to the spinal stenosis. You have bilateral knee degenerative joint disease, significant back pain, status, post-lumbar stenosis surgery. I'm recommending entire left knee arthroplasty. I am prescribing Demerol for pain control to de-addict you from having regular methadone dose.
Extract 2. Questions 13 to 24. You hear a physician talking to a patient called Mr. David Goggins. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Hello, Doctor. Good morning.
Good morning. May I know your problem?
Well, I'm getting frequent nausea and vomiting with an aspiration pneumonia and abdominal discomfort. I had an endoscopy which revealed a small ulcer after dropping my hematocrit. Now I feel anemic. I had a CT scan last week that showed pneumatosis and my cecum worrisome for ischemic colitis, bilateral hydronephrosis and multiple liver lesions. Yesterday, I had multiple bowel movements and passing flatus, and had epigastric pain.
Okay, what's your age?
67, Doctor.
Do you smoke or drink?
I have a chronic alcohol use, but I've stopped smoking long back.
Tell me your past medical history.
I have chronic obstructive pulmonary disease, history of pneumonia and aspiration pneumonia, osteoporosis, alcoholism, microcytic anemia.
Well, your physical examination shows you are afebrile. Your heart rate is in the hundreds to 120s, at times with atrial fibrillation. Respiratory rate is 17 to 20. Blood pressure 130s to 150s and 60s to 70s. Your abdomen is distended with tenderness mainly in the upper abdomen but very difficult to localize. The CT scan shows pneumatosis in the cecum, with an enlarged cecum filled with stool and air fluid levels with chronically dilated small bowel. There is a possibility of ischemic cecum with possible metastatic disease, bilateral hydronephrosis on atrial fibrillation, aspiration pneumonia, chronic alcohol abuse, acute renal failure, chronic obstructive pulmonary disease, anemia with gastric ulcer. I would recommend getting a repeat CT scan to assess it further to see if there's worsening pneumatosis versus resolution to further evaluate the liver lesions and make decisions regarding planning at that time. Since you have frequent desaturations secondary to your aspiration pneumonia and any surgical procedure or any surgical intervention would certainly require intubation, that would then necessitate long-term ventilator care. So I will look at your CT scan and make decisions based on the findings.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now, look at the question 25. You hear a discussion between a doctor and nurse about the cause of glioma.
Hello, doctor. What is glioma, and what is the exact cause of glioma?
Well, the exact cause of glioma is yet to be defined, although some hereditary disorders are known to increase the chances of developing these tumours. Examples of glioma include tuberous sclerosis and neurofibromatosis. Depending on the specific type of cells involved, gliomas are categorized into different types. Ependymoma tumour arises from the ependymal cells that are found in the brain ventricles and spinal cord. Oligodendroglioma involves the cells called oligodendrocytes that provide insulation in the form of myelin. Astrocytoma tumour involves the astrocytes, which are the cells that transport nutrients and providing structural support to neurons. Mixed gliomas are the tumours that contain a combination of cell types, such as an oligoastrocytoma, for instance. Question 26. You hear a lecture about Gaucher's disease genetics. There are numerous mutations are associated with Gaucher's disease, and nearly 80 known mutations are now associated with this disease. The mutations are categorized into three main types. Type 1, N370S, homozygote. These mutations result in the most common form of Gaucher's disease that does not affect the brain, and also called as non-neuropathic Gaucher's disease. This is common among the Ashkenazi Jews. Type 2, 1 or 2 alleles, L444P. These mutations result in severe form of Gaucher's disease that affects the infants. Type 3, 1 or 2 copies of L444P. This condition occurs in Swedish natives from the Norrbotten region, and significantly, the affected persons usually die before the age of 30. Question 27. You hear a monologue about biosensing.
What are the different occurrences of biosensing?
Well, when the bioelement binds to the analyte, the sensor is referred to as an affinity sensor. In case the bioelement and the analyte give rise to a chemical change that can be used to measure the concentration of a substrate, then the sensor is called a metabolic sensor. When the biological element combines with the analyte and does not change it chemically but converts it to an auxiliary substrate, the biosensor is called a catalytic sensor. Question 28. You hear a discussion between a doctor and nurse about hyperelastic skin.
Hello, doctor. What causes hyperelastic skin?
Well, a healthy and hydrated human skin has the capacity to stretch and then return to normal when released. This kind of process is controlled by two abundant proteins, collagen and elastin, which are found in the muscles, skin and bones. While collagen gives structure to the skin, elastin allows it to stretch. The skin is stretched beyond the normal limit when there is a rapid increase in collagen, or the production of elastin becomes low, and hence the skin loses its capacity for elasticity. This condition is known as hyperelastic skin. This condition is common in patients with Ehlers-Danlos syndrome. Question 29. You hear a discussion between a doctor and a health professional about cancer of unknown primary.
Hello, doctor. Can you explain cancer of unknown primary?
Although it is difficult to find out the originating site of the cancer of unknown primary, further study of the cancer will help to detect its origin. By investigating the cancer cells through a microscope, the oncologist can ascertain that the cancer cells belong to one of the following types. In the squamous cell cancer type, the cells are often flattened like skin cells or cells on the lining of some organs. Adenocarcinomas developed from gland cells are known as adenocarcinomas. Often the initial site of the cancer occurs in the pancreas, lungs, breast, stomach, prostate, liver or colon. Neuroendocrine carcinoma. The cancer in the neuroendocrine system alters the cells into nerve cells and hormone-secreting cells and spread all over the organs such as stomach, esophagus, pancreas, lungs and intestines. Poorly differentiated carcinoma. At times, cancer cells do not produce enough detail to identify the type of cancer. About 10% of these cases are detected to be lymphoma, melanoma or sarcoma. The cancer cells of poorly differentiated malignant neoplasm are positively cancerous. However, they are extremely abnormal to find the cancer type or the originating body part. Question 30. You hear a monologue about Sarin classification. The Sarin classification is the most helpful classification system to differentiate gastric varices. As per Sarin classification, the gastric varices are divided into 4 categories based on their location in the stomach and its association with the esophageal varices. Type 1. Gastroesophageal varices extend over the cardia and lesser curvature of the abdomen that ends in gastric fundus. Type 2. Gastroesophageal varices extends ahead of the cardia and leads towards the greater curvature of the abdomen and to the gastric fundus. Type 1. Isolated gastric varix exist in the gastric fundus, and they do not extend into the esophagus or the cardia. Type 2. Isolated gastric varix is defined as ectopic varices that occur in other parts of the stomach.